Hello everyone and welcome to this lecture on atraumatic restorative treatment or ART. This technique has revolutionized dental care in underserved population by offering minimally invasive, cost-effective and pain-free alternative to traditional restorative methods. In this session, we will explore what ART is, how it works and why it's such a valuable approach in public health dentistry.
The contents we are going to see for today are introduction, definition, principles, indications and contraindications, armamentarium, procedure, defective restoration, and finally we'll see about advantages of ART restorations.
Introduction. Atraumatic restorative treatment, commonly abbreviated as ART, is a preventive and restorative approach to managing dental caries. ART was introduced by Dr. Joe Franken in 1985 in Tanzania. It gained global recognition when the World Health Organization highlighted its potential during World Health Day on April 7, 1994. This marked the beginning of the year of oral health. Since then, ART has been adopted in over 25 countries worldwide, primarily for use in rural and under-resourced communities where conventional dental equipment and electricity were often unavailable. Let's see about the definition of ART. What it says is it aims to remove decayed tooth material using hand instruments only and restoring the cavity using a high viscosity glass ionomer cement. This not only arrests caries progression but also helps preserve the tooth structure and function. Principles. The core principle behind ART is minimal intervention. Instead of using high-speed drills and anesthetics, ART relies solely on manual tools, specifically excavators and spoon-shaped instruments, to gently remove softened carious dentine. This technique is patient-friendly, particularly for children and those with dental anxiety, because it avoids the discomfort and noise associated with traditional drilling. ART emphasizes two key goals. One is preserving healthy tooth tissue, and the other one is preventing further decay through fluoride release from the glass ionomer cement. ART uses only hand instruments and glass ionomer cement. Hand instruments. With this technique, the restorative care is made available to all population groups. It is cost-effective technique. Hand instruments allows for treatment in communities without dental infrastructure. Glass ionomer cement is the restorative material of choice because it chemically bonds to enamel and dentine. It releases fluoride which helps prevent further caries. It's biocompatible and safe for use in the mouth. Coming to the indications and contraindications. It is indicated only in small cavities and those cavities that are accessible to hand instruments, and widely it is performed in outreach settings, schools or during dental camps, making it highly versatile. It's not meant to replace conventional treatments but to serve as an effective alternative where those options are not feasible. Moving to the contraindications, however, it is not appropriate in all cases. It is contraindicated when there is pulp exposure, presence of swelling or abscesses, or when the cavity is too large to be effectively sealed by the material. It's also not ideal if the tooth is fractured or has mobility. Therefore, clinical judgment is crucial when deciding if the ART is right course of action.
The slide shows the case scenarios where ART is indicated and in the places where the ART is contraindicated. In the first picture is an indication for atraumatic restoration and the tooth can be filled with ART procedure. The third one, the tooth has a gingival polyp, and in the fourth case scenario it has a abscess in relation to the tooth. So these two scenarios, third and fourth ones, are contraindicated in ART. Armamentarium. This slide shows the material used in ART. The material of choice in ART is high viscosity glass ionomer cement. This material is ideal due to its excellent adhesion to enamel and dentine, its fluoride releasing ability, and its compatibility with the tooth tissues. The procedure uses only basic hand instruments such as mouth mirror, explorer, spoon excavator, mixing pad, and applicators, making it extremely portable and practical.
Moving to the procedural steps, simple and yet effective. The operator first sits at 12 o'clock position or 10 o'clock position. Uses a headlamp or mirror attached light for visibility. It's ideal to have an assistant by the side of the operator and close to the patient. The next step in ART procedure is isolation and drying the tooth surface. Use cotton pellets to dry and isolate the tooth. Then preparation of the cavity. Remove caries with excavators and unsupported enamel with an enamel hatchet. Cleaning the prepared cavity. Wet cotton pellets are used to clean the prepared cavity and 10% polyacrylic acid is applied to the tooth surface for 10 to 15 seconds. The next step in ART is mixing GIC. Mix GIC in a 1.5:1 powder liquid ratio in under 30 seconds. The final mixture should be in chewing gum consistency. Restoring the cavity. Mixture is inserted using blunt end of applier or carver. Then it's rubbed with petroleum jelly and pressed with the finger using press finger technique. Ensure no overhangs or high points and instruct the patient not to eat for at least 1 hour. Failed or defective restorations. Restorations may fail due to fracture or breakage, wearing down, loss of the restoration, or new caries around the restored area. Advantages of ART. The benefits of ART are numerous. It is minimally invasive, doesn't require electricity or expensive equipment, and is painless in most cases. The use of glass ionomer cement provides continuous fluoride release, aiding in caries prevention. It's also cost effective, quick to administer, and easily teachable to community health workers with basic training. Most importantly, ART helps increase access to dental care in low resource settings. A quick recall of the ART procedure. Initially, the operator sits at 12 o'clock or 10 o'clock position. Uses a headlamp or mirror attached light for visibility. Then isolation. Use cotton pellets to dry and isolate the tooth. Then caries removal. Remove caries with excavator and
unsupported enamel with an enamel hatchet. Then clean the cavity with wet cotton and 10% polyacrylic acid. Next comes the step of mixing and placing GIC. Mix GIC in a 1.5:1 powder liquid ratio in under 30 seconds in chewing gum consistency. Then insert it into the cavity using the blunt end of carver. Rub petroleum jelly over the restoration and press with the finger. Ensure no overhangs or high points. Then instruct the patients not to eat for at least 1 hour. This consolidates the steps of ART. To conclude, atraumatic restorative treatment is a powerful tool in global oral health, especially in outreach and resource limited settings. It offers a humane, effective, and accessible approach to dental care that aligns with the principles of minimally invasive dentistry. As oral health professionals, understanding and applying ART can significantly contribute to improving dental outcomes in underserved populations. Thank you for listening.